Uncompensated care in Wisconsin hospitals has increased by $50 million in fiscal year 2020, bringing the grand total of uncompensated care to about $1.4 billion in the state. Uncompensated care is a combination of charity care and bad debt. And a new report, the Uncompensated Health Care Report for Wisconsin hospitals in fiscal year 2020, as released by the Wisconsin Hospital Association, tells us that $683 million in fiscal year 2020 was charity care, while $743 million was bad debt. And that bad debt number is up about $60 million over the previous fiscal year. It's a concerning trend. Uncompensated care has been steadily increasing in the state of Wisconsin since 2016. And the impact of that, especially on disparity families, can be quite large. Harassment, court summons, and default judgments are what happens when bad debt turns into collection actions. Disparity families are unequipped to challenge these debt actions alone, although most of the time they are unrepresented in court actions. Consequences are wage garnishment in addition to family stress, and in some cases, disrupted access to health care. Now, some Wisconsin hospitals said in fiscal year 2020, they paused collection actions because of the COVID pandemic, but others ran full steam ahead with plans to resume in the months ahead, even if they did do a small pause in their collection actions. But the pause doesn't mean that the debt or the bills go away. It just means that that debt hangs over family a little bit longer. And the real winner in these bad debt and collection actions is not the hospital, it's the collection agency. But unfortunately, a lot of hospitals have maintained their partnerships with these collection actions, so they do persist. Now, there are some solutions, and some are quite easy. The first is just to get involved earlier. Hospitals can be more proactive about helping families find health coverage before it turns into a back-end bad debt or collections action. They can hire staff that are trained helpers that can promote health equity and working with their families to make sure they're not suffering these financial pains. They can know federally required charity care rules and options. They can create programs and policies that promote seamless, comprehensive care and coverage for patients. And they can include strong consumer assistance and protections, especially as we continue to work through the COVID pandemic. You can read that Uncompensated Health Care Report for Wisconsin hospitals and our press release. We link to both in the description below.